So I
Right.
think reducing the fee is the wrong approach.
Okay.
Okay, so let me tell you a different approach. This approach is, all right, it's our treatment standard that we are going to offer, that we are going to do a fluoride or caries risk assessment
Oh, yeah,
on every single patient. If you don't do one, you have to document it in the chart. This is a clinical standard, and there's no really two ways about it. If there's a reason you didn't do it, you've got to put it in the chart,
Okay.
right? And at the end of every day, what are you going to do?
Look at who did.
You're going to look through and see who did it, who didn't do it,
Okay.
right? And your fluoride case acceptance will go up a lot.
Okay.
Now, I would have a meeting about the caries. You've covered it already. But I would definitely go over it again to just kind of fresh it in everybody's mind. And it's not negotiable, right?
Right.
If they wanted to leave a big hunk of calculus, right there where the patient can pull down their lip and see it, what's that? Is that acceptable? No. To not offer fluoride is not acceptable. If I were a patient and there was something I could do to prevent further disease and it wasn't offered to me, I'd be pissed.
Yeah.
I would. I'd be pissed. It's unacceptable. And you just have to, some things you kind of ease your team along to. This one, no, this is a clinical standard. This is what we're doing. And once you go through the caries risk assessment, there are very few patients who don't say, oh, all right, I'll get it. Right? There's very few. And once they do it once, now it's just part of your standard of care. Right? You're doing it every time after that. But getting them to do it that first time is important, which is why one of the strategies they have, but this really doesn't fit so much in your situation. But for those of you who are pretty good but want to bump it up a little bit further, give a free one after any restorative treatment and say, we want to protect this. We want this to last a long time. So we'll be doing this at all of your hygiene visits. We'll be doing these fluoride treatments. It's just a way to convert people over that maybe haven't been converted in the past. And so the reason why I said don't lower your fee to get people to do it, because the fee isn't the obstacle.
Gotcha.
The obstacle is the team not believing in it, not buying into it, and not willing to do the work to do it.